Good evening, everyone, and welcome to What to Expect from your Rehab Telehealth visit. My name is Kayla Hazel. I'm a physical therapist at HSS. On today's webinar, we're going to talk about how to access rehab care virtually and how to make the most of these virtual visits. Our guests today are Kerry Ebert, Ashley Fluger, and Laurey Lou. Ashley is an exercise physiologist at HSS, and she has experience with the patient population ranging from athletic development and preventative health to various disease states and orthopedic conditions. Laurey is a physical therapist at HSS. She enjoys working with a diverse patient population and strives to get people moving again, whether to chase their Olympic dream or their kids around the playground. Kerry is an occupational therapist and has 14 years of hand therapy experience specializing in traumatic injuries of the elbow, wrist, and hand, soft tissue injuries, custom orthosis design, fabrication, and telehealth. We're going to get started with a few questions. Feel free to use the Q&A function if you have any questions that come up as we go along. So our first question we have is, how does the length of a visit face-to-face time with a PT, OT, or an exercise physiologist compare to an in-person rehab or performance visit? Kerry, do you want to start us off with this one?
Sure. Thanks, Kayla. This is a great question. All of our telehealth visits, as well as our in-person visits, are exactly the same length and time. We start off with a 40-minute initial evaluation where we'll do a comprehensive assessment, determine your treatment needs, set your treatment goals, and then as well as provide you with a comprehensive home exercise program. And then all other follow-up appointments are typically 30 minutes.
Thank you. That was great. And Ashley, what about from the performance exercise physiologist side?
Thank you, Kayla. So great question, because with performance, we do offer a few different options. So we offer both 30-minute and 60-minute sessions, as well as small group training. So if you have a family member or a friend that you want to exercise with, that's definitely an option. So your first session will be a 30-minute complimentary session. And in this appointment, we'll go through your health history, we'll talk about your fitness goals, and then go through a brief movement assessment so that we could see how your body moves and establish a baseline of your current fitness level to make sure that our first appointment together, whether it's that 30 or 60-minute, is appropriate for you.
Great, thank you. A group session sounds fun. All right, the next question we have coming in are there specific benefits to rehab or performance telehealth visits versus on-site visits, such as a lower risk to exposure, cost, efficiency of care? Laurey, what's your experience with this?
Oh, sure. So, top of mind is what you were saying, the exposure risk. So I think with COVID and the world that we're living in right now, that seems like the biggest reason why people want to do telehealth visits. But actually, telehealth was gaining popularity before COVID even hit because of some of the benefits from like efficiency and accessibility. So, for like schedule, it's more convenient to schedule during the day if maybe you have child caretaking duties or you're working, but you still want access to HSS care, or if you live out of the area, it makes it so that anyone can really have an appointment either for rehab or performance. Cost wise too, sometimes what can be a big benefit of telehealth, well, first of all, you don't have to go there. So whether it's the subway or car, or if you're post-surgical, it might be an Uber ride, so those costs you don't have in telehealth. And in addition, with some diagnoses, I find that I see people less often because it's more of like checking in and making sure that they're kind of doing their program and progressing nicely. So overall, they're saving on their co-pays and time in rehab. And another benefit that I actually didn't think of when we first started migrating to telehealth is really like seeing what people are doing at home. And I guess when I first transitioned over, I had patients that I had been seeing in the clinic for weeks, maybe months. And when it transitioned to home, I was like, oh, just show me how you're doing this at home. And they would show me something. And I'm like, really? That's how you've been doing it like this whole time? Like, so it was shocking to kind of see the difference between what I thought people were doing at home and what they actually were doing, because they were kind of rigging up things on their own. So that's actually been a major benefit for me, is to be able to see people doing their home program, seeing how they're set up ergonomically, having them just lay in bed if they're having pain, when they wake up. So that's been, the hidden but really great benefit of it on the PT side.
Yeah, I completely agree. Even today, I had a teenager come in for an eval who had surgery, and his mom was stressing out because she works full time, her husband works full time. How were they going to get him to therapy? And I'm like, why don't we do telehealth once a week? This way, you don't have to worry about coming here multiple days a week. And it was a huge stress relief. We were able to create a really nice schedule out of like an experience that was really causing a lot of stress and anxiety.
Right.
Ashley, what about with your performance clients? Like, what benefits are you seeing from telehealth?
So one of the big benefits is that we finally can help and work with clients all over, because the access to care is just endless. So for example, one of my clients that actually moved out of the country, I can see her now. Or one of my past clients who, moved to a different state, we're able to work together now. So able to reconnect with old patients and also treat others that are living all over the country. And another really big benefit that I see with exercise, clients seem to really become more comfortable through telehealth sessions, incorporating exercise into their everyday life. And really, rather than making their workouts like compartmentalizing everything as you go to the gym for your workout, they're learning how, as they spend more time at home, to incorporate movement into their daily routine, which is really important.
And I feel like we all need a little of that with like how much like the world's been crazy and our routines have been uprooted. It's nice to be able to have that seamless transition throughout your day.
Definitely.
And Kayla, also from the PT side, I'm co-treating a lot. So there's some patients who are going into the clinic once a week, and then they'll be doing telehealth once a week. So it allows them to get the benefit of both worlds. And also it allows them to have a little bit less stress on their schedule with getting to the clinic or not.
Exactly. Like that hybrid model has really relieved so much stress that patients have about physically getting into the clinic. Great. That was really helpful. The next question we have coming in is, what types of rehab goals can be most efficiently addressed at a virtual visit, as well as performance goals? So I don't know, Kerry, do you want to start us off with this one?
Sure. This is a really great question for OT specifically and hand therapy, because there's a direct translation of treatment into your home because you're in your home. So a lot of times we're using functional analysis. We're having you perform functional activities, determining what you're having a hard time with, figuring out ways that we can make that easier for you and you can accomplish your goals. In addition to that, we can also do ergonomic work setups, so we can assess your workstation now that everybody's sort of working from home, and we don't see that changing anytime soon, and we're all feeling the stress of it for sure. In addition to that, getting back to sport, I have a kid today who I had swinging a golf club in his front yard and holding a lacrosse stick, or I have another patient where she picks up her guitar and I'm analyzing her posture and how she's playing her chords, and we're trying to work on her treatment goals in addressing those needs to be able to return to play, return to work, and return to instrument, as well as your normal activities of daily living.
Definitely. And it's so nice to see patients in their own environment. What about you, Laurey? What have you really seen? What goals have you been really addressing with patients during your virtual visits?
So I would say, so similar to Kerry, it's been really nice, to see people's ergonomic setups, or, if they play sports, they have a little bit more room and we have a little bit more flexibility. So sometimes I'll say like, hey, next session, can you set up the camera here or there, versus in the clinic where sometimes we can get bigger space, but sometimes we can't. I would say in general, the types of rehab goals that are probably most effectively treated on telehealth would be, goals related to pure strength and goals that are related to like patient education.
Mhm.
Things that need a little bit more of that manual component. It's not as efficiently addressed in telehealth, a little bit better with either the hybrid or in clinic. Although I do have some people who, that is one of their major goals, but they're very concerned about COVID risk. And I respect that. And I basically say to them, like, this is going to be a little bit slower. It might, the progress might not be as fast as it would be if you went into the clinic, but I respect that, you're concerned about exposure risk. And there's always ways that you can educate people to do self-mobility and be working on things on their own, and kind of on as a side benefit of telehealth. I found that patients they have to be just much more in control and aware of their own programs and in control of their own rehab, versus more of that passive, like, I come here twice a week and you do this thing and then you tell me what to do. So that's been, something that's really, really important. And I find that the more people can be, take charge of their own rehab, the better outcomes that they really have.
Mhm. Yeah, I completely agree with that. I feel like it's really put like patients in the driver's seat of their care, and they can really have like a really nice involvement with it. Ashley, what about with your clients? What types of goals are you addressing?
I
I know
love
you touched on this a little bit before.
Yeah, so I love this question because on our first appointment, this is one of the most important things we talk about is goals.
Mhm.
And the great thing about performance is really the goals are endless and so personalized to what you're working towards. So really anything from weight loss, weight gain, balance, injury prevention, bone health. If, for example, you're not able to play your sport, but you need to stay in shape. The goals are literally endless. And what's so great about the whole team that I work with, all of us, we have various skill sets, additional certifications, and all different passions that really enable us to work with all types of people. So, for example, the age range is like 11-year-old to a 97-year-old in a wheelchair. So literally the spectrum is huge and endless, and it's what makes it fun. We
Mhm.
love
Yeah, keeps it exciting.
Absolutely.
Great. Those are all phenomenal answers. If you can't tell already, we all love telehealth. Now, I feel like the question that everybody wants to know is, how does this work? What actually happens in a telehealth visit? Ashley, do you want to expand on what you were talking about with your goal setting and kind of take us through a typical session?
Definitely. So just to back up for 1 second before we start the session, all your virtual care is initiated through your My HSS app. So when you make the appointment, the front desk will reach out and call you and make sure that you have the My HSS app and the Zoom app downloaded on whichever device you'll be doing your sessions on. And all the Zoom sessions are HIPAA compliant. So everything is very secure and private. So definitely do not be concerned about that. And these are extra security features that really aren't available to the general public. So everything is very private. So once you log into the My HSS app, on my schedule, there's a little camera that turns green, and that's how I know you're there and ready to begin the session. So I double click you, and that calls you, and we connect. And really, the position of the camera, what we're working on that day, equipment we need, we'll really go over all of that on our first session to make sure that as soon as our cameras connect and we're on Zoom together, we're ready to go, so that we're really not wasting time with the camera. And then based on your fitness level and your goals, we start.
That's great. And you feel like you're able to explain the exercise as well. Patients and clients are able to really like pick
Yeah.
up. I know some people feel like when they don't have that hands-on treatment that they may not understand it as much.
Definitely. So I always make sure my clients' cameras are on an angle that I can clearly see them, as well as my camera, because demonstrating an exercise is really, really important. Although also the specific cueing that we use to teach the exercise is always very clear and concise. And everyone's been responding really well to it and love it.
And it's great. Kerry, did you have something to add?
Yeah, I just got the feedback with one of my last patients today. She was like, this is really wonderful because sometimes when I'm in the clinic, I don't know if I'm doing it correctly when I get home. And now I have you to double check to make sure I'm doing it correctly. So this is wonderful. You know, she was so excited. Just the reassurance that, again, that carryover from therapy into the home environment for their independence with home exercises happens immediately. So it's really great.
Some of my clients who have something as simple as dumbbells at home, I'm like, oh my gosh, you are so lucky to have that. Gym equipment's so hard to find now. And I've had it for the past 12 years, but I never knew what to do with it. So finally, everyone's gym equipment is being used.
Hot commodity these days.
It is. It is. That's great. And I think something too that's been nice is just for the carryover, I've just been emailing my patients their home exercise program. So the document with the picture and the written instructions, and it's nice. Everybody's been keeping it in one file as opposed to printing it out as they leave, then you put it in your bag and it gets all lost. So it's been nice. You do the virtual visit, you send them over their home exercise program, and everyone's really able to keep things organized and accountable and use that gym equipment that we've all had sitting around for years in a good way. We'll move on to our next question. It's a little bit of a fun one. It's a case scenario. So let's imagine a woman was playing catch in her backyard with her child when she suddenly feels pain and thinks she pulled a muscle in her shoulder. She has some pain in her shoulder that continues over the next few days. Is this something she could see a physical therapist for without a prescription? Like, is this appropriate to be managed over telehealth? Laurey, do you want to kind of start us off with this one?
Sure. So it's a great question. It's got a lot of layers to it. So so first,
very creative.
I would say first is, you know, the idea of like seeing a physical therapist without a prescription. So we call that direct access, but basically it's basically being able to see your physical therapist without having a prescription from your doctor. And the laws are a little bit different state to state. So it's definitely something that you want to make sure with your state laws, as well as there's differences on insurance coverage. So, you know, that's, and those rules are just really in the goal is to protect you as the patient, because, you know, having the physical therapist as the first point of contact versus having a doctor and a physical therapist and, you know, you just want to make sure that it's appropriate. So as a physical therapist, and I do see a lot of patients in New York at direct access before and now in telehealth. So there's always been, I guess, an extra layer of care that needs to be put on that first appointment to make sure that person's safe for physical therapy. Okay, that's not even the telehealth piece of it yet. And that's just, you know, is this truly a musculoskeletal, like a muscle issue, a strength issue, a weakness issue, you know, or is it something that could be more serious and it just looks like this? So, you know, it's really important on that first visit to be able to tell the difference and be very critical about that and be open with your patient and tell them that, you know, we're going to do this for a couple of visits. And if, you know, these things are happening or these things aren't happening, then I'm going to refer you to a doctor and, you know, you need some medical management. In the telehealth world, that kind of takes an extra step because I can't get my hands on people. So I need to be confident that the person, you know, there's not something that might be benign or dangerous going on that I can't appreciate in the visit. So, you know, in this case, it definitely sounds like something that is appropriate to be treated on telehealth. So what I would do is I would say like, okay, that story in my head, that makes sense, is something that could be seen in physical therapy and telehealth. And then, you know, I'll have her start going through some of the motions and see where her pain is, see what the pain level is, and then make sure that it kind of fits into what I clinically would recognize as like a musculoskeletal issue, like you just pulled a muscle. And then again, I would explain to her, like, if it's a muscle pull, if you ice it and rest and do some of these exercises, it should feel better over the next few days. It won't be completely better, but it should be going that direction. If it's not, you know, there's an understanding that one, if it's, you know, really bad and there's a lot of pain and there's some signs that just don't clinically make sense, you might have to go to a doctor. Or two, if it's like your shoulder, you start losing a lot of range of motion and it's happening very quickly and acutely, I might say like you should go into the clinic for an in-person physical therapy visit. So it's very much an education and open communication between me and the patient when I'm seeing them, direct access.
Definitely. And that's just so important regardless, is to have that open communication with patients, especially with direct access. Now, if a patient did have a question, like a potential patient, I should say, if they can be seen direct access, they just have to call one of our offices, correct? And we can help guide them in that direction.
Yeah.
Aw-
Yeah.
Awesome. Thanks, Laurey. All right, we actually have another case scenario. So, a man would really like to get into running and wants to start training to eventually run a half marathon. He wants to avoid injury and make sure that his form/running mechanics are correct before beginning. He sounds like an all-star patient. Can an exercise physiologist help him with this over telehealth? Ashley, what are your thoughts?
100%. Yes. And first and foremost, and you said this in the case study, avoiding injury and being strong while you're running a half marathon. We really have to think of the other components that create a comprehensive fitness program for someone who's so of course, through telehealth, we can definitely teach different strengthening exercises or different flexibility, mobility work to do, work on some cross training, and also teach this potential client, for example, on race day, proper ways that he could warm up outside by himself. So yeah, 100%. And I think every runner should be strength training, and they definitely would benefit from it. In terms of running mechanics, so we do offer run-specific testing, and maybe that, which we do on a treadmill, you may want to come into the clinic for. But in terms of exercise and training program for running a half marathon, absolutely, we could do that on telehealth.
That sounds great. Anyone have anything else to add, or are we ready to move on? All right, we'll move on. Now, the next question we have is it safe to go in for an in-person rehab and performance visit right now, as we're kind of talking about the need to go in person versus telehealth? What are the updated safety measures for COVID-19? Kerry, I know you have some experience with this. Do you want to speak to it a little bit?
Yeah, this is a really great and I think important question as things are constantly changing and evolving with COVID-19. And as we've all mentioned, Ashley, Laurey, and I, so often we are engaging in a hybrid model that we offer and encourage to our patients, whether they need to go in for manual, whether they need to go in for a run test, whether they need to go in for a customized splint. It's really important that our patients feel safe and confident in our ability to protect them as well as our staff. So HSS has really done an unbelievable job of enforcing, really strict precautions. Everybody is screened as soon as you walk into the building. Your temperature is taken. You're provided and required to wear a mask. And we really enforce the social distancing, whether it's in the hallway, in the waiting room, or even in the clinics. Everybody is spread out, and we are really taking this very seriously.
Yeah, that's great. And I think I've seen it kind of going from the main campus to our different regional locations across HSS. Everyone is taking it so seriously. The staff members are taking it so seriously. I don't think I've ever gone through this many Sani wipes or pairs of gloves, just making sure everything stays clean. But we're so grateful to have that and to be able to use all of that equipment. Now, we've talked about a lot of the really good parts of telehealth, but we do have a question about kind of the other side, the limitations. Laurey, have you experienced any limitations with patients on telehealth? I know you were speaking to this a little bit about the question with direct access, but in terms of like the physical exam and exercise, where have you felt a little bit limited, if at all?
Yeah, so it's definitely different evaluating a patient on, in person and in telehealth. And I think in the beginning, my struggle was, this is how I do it in the clinic. How can I completely replicate that in the same exact way on telehealth? And I think that, over the course of seeing lots of different patients, what's clear is that the goal is still the same. You just have to see, what's contributing to the patient's symptoms, what's limiting them from what they want to do, and, and how do you figure that out? So it's sort of like the same but different. So, for example, if you're looking at someone's range of motion in the clinic, you might actually take their arm and move it passively and then measure it with a goniometer or like a protractor looking tool. You know, and then so now, you know, what I started to do was, you know, I'll have them do it themselves. Like they move their own arm, or maybe they hold a stick and they're moving it, or maybe, you know, their spouse or someone there is moving it. And then I'll use a measuring app on my computer to see the angle, or I'll hold like a ruler up to the screen to see it. You know, and the same thing with strength. Like there's tests I used to do in the clinic that I just can't do. Like I can't push on your leg and see how strong your leg is. But what I can do is see, you know, how many single leg bridges you can do in a row. And I can see how many times you can sit to stand from a chair and see how fast you can do that. And so there's a lot of ways that you can still look at things and say, like, you know, that's limited, your leg strength is limited, but I can put a number to it. So then I know that as you're going through your program, I can track your progress and make sure that, you know, what we're doing is, you know, is getting better. And I think all of my patients have gotten some anatomy lessons for like self palpation. So I'll have them say like, okay, there's a bone over here. Now, right off of that bone, you'll feel like a little bit of a ditch. Do you feel that? Okay, great. I'm like, okay, is that where it hurts? Or, you know, and so I'll have a lot of patients do their own palpation, you know, obviously, and that point with palpation, there is a, you know, a piece that is a big limitation of telehealth, because I can't put my hands on them and actually feel what they're feeling. So basically I need to take their basically what they're reporting, which is also really important to get a patient's report of things, or they can just show me and point. But sometimes I just wish I could like put my hands to the screen and feel it. And so when that becomes an issue and I feel like something that is, you know, that would really contribute to their care, that's when I'll have people go in. And sometimes I just have people go in for one visit. I'm like, just go in and then, you know, have hands on you for one day, and then that clinician can then talk to me and say like, hey, this is what I felt, and then we can just carry on with the telehealth, you know. Or sometimes if it's something that's longer term, they'll transition into the hybrid model that we've talked about before. But it's all about being creative.
Yes. Yes, a lot of creative solutions. Kerry, did you have something to add?
No, just exactly what Laurey has said. You know, I think we look at this as a limitation, not being able to put our hands on patients, but at the same time, it's really enabled us to empower them and teach them and share our knowledge and really think outside the box and get creative with how we deliver treatment and how we assess things. And I think across the board, we're constantly, again, keep coming back to this hybrid model of, we're just going to you're seeing the doctor on this day. I'm going to set you up with my colleague who I've already talked to about this. They're going to get their hands on you for one visit. Or in my case, a lot of times, the only thing I haven't learned to do on Zoom is fabricate a custom splint, but I'm working on it. But a lot of times I will refer to my colleagues and be like, okay, you know, they're going to make you this splint. These are your instructions, and then you're going to resume right back into telehealth. So
Yeah.
Some look at it as a limitation. I think it's really been fun, and it's been a great challenge.
And I think the patients rise up to the challenge too, because I think that, you know, patients knowing their strength score from me pushing on them, that's not something that they can gauge every day, but they know how many calf raises they did or how many bridges they did, and it makes them really motivated. And they'll be like, Laurey, I did like 20 of them, and I'm like, okay, like, you know. So and it also gets their spouses involved. Actually, one of my patients' husbands bought a goniometer, and so it was like the measuring tool that we use. And like, so one time she was like, look, I got 125 degrees of knee bending, and then he like measured it, and he was like, how's my form? He's like, I'm lining it up with this bone and this one. He's like, I saw it online. And I'm like, that's great.
You should go to PT school.
Involvement is so important also, because this thing, you guys, I have clients that, you know, maybe I was working with the daughter and then her dad starts to train and then everyone else gets a little curious, and we do once a week family workouts now. And her parents say this is like a major silver lining of COVID. And if this craziness ever ends, they're going to do their family workouts once a week. I love it.
My favorite part is when like the spouse or a family member is acting like the camera person, and they're like, is this okay? You need me to go higher, lower?
That's so it's like a personal assistant.
It is.
Little angle.
And it's just so much fun, and I think the patients have fun with it, 'cause it's something they've never done before. And honestly, during COVID, where everybody's been kind of inside their house, it's really something fun to break up the day with. Well, thank you everybody for your input. I think those are some phenomenal answers. Kerry, yo, go for it, Ashley.
Can I just make one comment about performance?
Of course.
In terms of any limitations. So a lot of the assessments, many of the assessments that we could do in person, we can also do through telehealth.
Mm-hmm.
In terms of having our hands on someone, something like body composition where we use the skin fold calipers, that we can't do through telehealth. Or if there is a way, I don't know how, but I don't think there is. And then also maybe more of just the sport specific analysis. So if we go back to that runner, if he wanted to come in for a run analysis, we'd obviously have him on the treadmill with either an iPad or some type of 3D motion capture that we don't have through the computer. We definitely have some cool technology that can complement our knowledge and our care for these clients. So either using the Laurey motion capture, we have a TrackMan that Laurey's probably used before with our golfers that come in. So again, based on your goals, a lot we can do through telehealth, but that same hybrid model, maybe coming in and using some of that technology to enhance your program is always a really good option.
Mm-hmm. Definitely. That was a great point. Kerry, I know you love telehealth and are super passionate about it. So kind of tell us about the quality of care. Do you feel like you truly are able to deliver the same quality of care virtually that you are in person?
Yeah, this is a really great question. I get it all the time from patients. I get it from colleagues. I get it from admin. I get it from my parents. Yes, absolutely. Like 100%. I think every practitioner at HSS, as we know, is committed to providing the highest quality of rehab care and services across the board, whether it's in telehealth or hybrid or all in person. We all love what we do, and I think we all strive to be the best at it. And I hope that people watching today can get a sense of that. And I think that this is what sets HSS telehealth apart from any other institution, is that we're providing HSS care anywhere, whether you're down the street, whether you're out on Long Island, whether you're in Florida, whether you're in the Berkshires, anywhere. You can receive HSS quality of care wherever you are. And the best part is we maintain that continuity of care and communication throughout the whole entire rehab team, from your nurses, from your physician, to our colleagues who are in person, who might be seeing you for that one visit. We are constantly in communication and updating one another, and we all really, I guess, are just so committed to providing the highest quality of care and ensuring that you meet your rehab goals.
I feel the same exact way, and I'm not going to speak for Laurey and Ashley, but I feel like they also probably feel the same way.
Yeah, definitely. Agreed.
Great. So now we're going to move on to, I know we've touched on this a little bit in other questions, but are there any visits you have I would not advise using telehealth for this? Laurey, I know you were talking about this a little bit with more of the manual therapy type stuff. Can you just elaborate a little bit?
Yeah, so I think that there's sort of like a continuum of, there's a point where it might not be as efficient to be treating telehealth versus non-telehealth for some of those mobility deficits. Where I'll draw the line and say, like, this is not appropriate is when it's unsafe. So that's going to be, whether you're a falls risk and you need someone guarding you. Sometimes there's range of motion or movement restrictions after surgery, and something actually needs to be moved. Like after a rotator cuff repair, you actually need someone to passively move your arm. And if you're doing it on your own, like, you're probably still activating your arm. So for those, definitely, maybe if there's like a weight bearing restriction. So that's kind of a case-by-case basis, because if it's something that's a weight-bearing restriction, it might be, nice to not have to come into the clinic if you have a boot on or something like that. But then sometimes there's a weight-bearing restriction, and some things that we have in the clinic, like our anti-gravity treadmill or like a leg press, where you can take some of the weight off, like some of those tools, or the pool. So some of those tools we have in the clinic to actually continue your strength program without having your full body weight. And that's something, that can't be done over telehealth. Although one of my patients does have a shuttle, and I don't know how. She was like, "Oh, I have a shuttle. Would that be helpful?" And I'm like, yes. Like, but those really, like falls risk, surgical precautions are kind of the major ones. And then, there's some other ones that, I'll tell people like this really should be something manual. Your range of motion is severely restricted and there's a time frame to it. So it's acute, it's happening really quickly. You really should go in. And, sometimes people will go in, sometimes they're very opposed to it. And I'll say, listen, I'll do like 2 visits or 3 visits, but if you're not getting any better, you have to go in. Like that's just, that's kind of the way that it is. So again, it's back to that communication piece of understanding, like, I'm trying to, as much as I can give you the best quality of care. And if I feel like I can give it to you over telehealth, I will. If I feel like you have to go in, I'm going to tell you, the pros and cons and the truth of it. So.
And I think that's really important because we're just trying to maximize everybody's time and resources. You're not going to have them keep doing telehealth if we truly don't feel like it's effective and know that there's something better out there for that patient. Ashley.
I really appreciate that seamless communication between all their providers. Even someone that could be new to performance that I haven't actually met in person, the fact that they could see me and then go see one of their doctors and then maybe go in for a massage and use all different types of services at HSS and everyone's on the same page no matter which appointment they show up to is really important to them, and they appreciate it and value it and notice it every single time.
And I think that's one of the greatest things about HSS is that we're really able to kind of have that communication, easy transition, quick answers to questions. I know you touched on this, Ashley, with kind of the sports specific stuff, but anything else you wouldn't advise telehealth for?
I would agree with Laurey. If you're fall risk and maybe you need assistance exercising and you live by yourself, then telehealth may not be the best way to exercise. Then again, we do have people that are wheelchair bound and do all their exercise seated, and it works.
Yeah.
I mean, everything we do, safety is the main priority. And of course, we would be nothing but honest to the patient, just like Laurey and Kerry said, that if telehealth isn't appropriate for them. I had a client who connected her telehealth appointment to her landline. And she's like, I'm going to do my side steps. And then I heard a big click. This isn't going to work. Definitely, if you do not have a camera on your voice, telehealth is not for you.
Well, I think that's an important point, that there has to be a camera involved.
Right. So it definitely is important that I can see what you're doing and know that you're safe.
Yes. One of my patients said at the beginning of the pandemic, there was like no webcams available to be purchased anywhere. Like they were all wiped out, which I could definitely see.
Webcams and gym equipment.
Yes. Speaking of gym equipment, we have a few questions of kind of the logistics of visits. So I don't know if each of you kind of want to go through your spiel, but what should patients be wearing? What special equipment do they need? Ashley, do you want to kind of keep rolling with this?
Sure. So in terms of clothing, I think most important is wear something you're comfortable in. But especially looking at your first appointment, the assessment, if you are comfortable wearing more of a fitted outfit, I think that would only benefit all of us, because in terms of your spine, your shoulders, your hips, your knees, I'll be able to more effectively see how your body moves rather than wearing baggier clothes. But then again, totally wear what you're comfortable in. Don't ever let wearing fitted clothes on your assessment make you not want to do performance. And then in terms of any special equipment, I really drill home the importance to my clients of being able to move your body weight before adding any additional load. And so any equipment they have is a bonus, because there's plenty of ways to make exercises easier or harder.
Yeah.
By the speed you're doing something, the range of motion, the rest. So there's many factors that if you have nothing, then that's fine.
Yeah.
If you do have equipment, it's kind of like your goals. It's endless. So you could buy equipment. We could talk about your goals any specific budgets that you have, we can find equipment that's affordable for you. It's also important to note that HSS can also mail you a package of resistance bands to use. So you'll have a lot of stuff, or even if you just have your own body weight and bands, what you can do with bands, like the gym equipment, and your goals are endless. And it's just time to get creative and use our knowledge to get you strong.
So basically what I'm hearing is telehealth is limitless. As like the biggest limiter is kind of our own creativity. Laurey, do you want to kind of add from the PT perspective what you like patients to wear, any special equipment?
Sure. So like Ashley was saying, you have to be comfortable in what you're wearing, but I also have to see what you're coming in for. So I know that, there's been a number of times where I'm doing an evaluation in the clinic for someone's knee and they come in wearing like skinny jeans. And I'm like, really? This was the choice? So what's great now is that if people are wearing things where I can't see, I'm like, hey, can you go and change and then come back because they're home. So, so a lot of times I'll be like, do you have shorts or do you have something where I can see your knees, or do you have something you can roll it up? Obviously after the first visit, they'll kind of have an idea of what they need to be wearing, what they need to be doing. But on the first visit, I'm kind of like, whatever you came in, as long as you're comfortable, and then, kind of make do as we can. And then for the equipment standpoint, so I agree with, there's a lot you can do with body weight. I think as physical therapy differs a little bit from performance, sometimes we have to go very, very, very specific on like certain muscles. Like if there's a muscle that was torn, or, that's what we're focusing on, or a tendonitis or something like that. So, bands, ankle weights, things like that. So you can actually like isolate that one muscle is really, really important. So a lot of times in the first visit, what I'll say is like, first tell me what you have, right? So it's like, it could be, bags of flour, and it can be like someone tied a can of soup to their leg using a TheraBand. And I was like, great, that's awesome. I was like, do it over carpet in case it falls out, but like, that's really good. So I'll try to use what people have. I actually had someone do clamshells with a pair of leggings once. But anyway, so, it's like, I'm sort of like, whatever you've got is great. Again, like Ashley was saying, HSS mailing the bands is really helpful, because what you can do with a band, to use limitless again, is limitless. Like you can replicate like a bench press by like putting bands over your shoulders and pushing up. I mean, there's a lot of ways that you can be creative to add load with bands. So bands, random weights you've got around, if you had a specific surgery or procedure where you need something like an ankle weight or something like that, I'll tell you on the first visit. But usually I'll message people and say like, these are some options. These are some like really cheap options. If you want to go more expensive, these are, the more expensive versions of it, but it's like, these have handles and these don't, or, whatever. So I try to use as much as what people have at home, and then give them suggestions that are, again, within their price range, and, like the most important stuff. And then like these would be nice kind of stuff.
Definitely. What about you, Kerry? What do you need from patients from your perspective?
Yeah, I mean, just exactly what Ashley and Laurey said. I need to see your hand or your elbow or your wrist. So really, camera setup is the number one thing. So I can see whether there's swelling or if there's scar tissue, fully assess the range of motion limitation. But on top of that, the cool part about being an OT is that we're trained to get creative in, the home. So just like everybody's been saying, grabbing water bottles, using those as weights, using frying pans, using hammers. I have towels, anything in the household we can use, and we can get creative and replicate whatever exercise we need to do to work on strength, range of motion, all of that. And then just like Ashley was saying and Laurey mentioned as well, HSS is super responsive about sending out putty for strengthening, or Coban for swelling, or isotoner gloves, or even prefabricated splints. We have an amazing staff that while I'm on a call with a patient, I'll just shoot over an email and say, hey, can you send this to so-and-so at this address? And they'll have it within just a few days. And then on top of that, if there's something that I really think that they should purchase online, because we're already on the computer, I just Google it, add a link for Amazon and then send it to my patient, and they literally purchase it while they're on the call with me, and I know they're getting exactly what they need, and it's usually there the next day. So this has been actually pretty awesome as far as being creative, implementing different household tasks to meet our treatment needs, and then also just accessibility to equipment as long as it's in stock.
Definitely. And I think kind of what we learned from all this, just to wrap it up in our last minute together, is that telehealth has been a really great way to get creative about reaching goals in a way that we never even knew we needed to get creative. And to use the phrase one more time, the possibilities are limitless. That's all we have time for today. Thank you all for tuning in. And if you have any questions or would like to learn more about HSS, feel free to email pped@hss.edu. For more content on telehealth and overall wellness, visit the HSS YouTube channel. The link is in the chat. And I just want to thank our speakers, Kerry, Laurey, and Ashley, for joining us tonight. I really hope you found this conversation entertaining and both informative.
Thanks, Kayla.
Thank you all.